Good evening, ladies and gentlemen. Thank you for listening to my presentation. The title is Firework-Related Eye Injuries, the Trends in the Netherlands, Western Europe and Beyond. I personally have no financial interest in the subject and I will continue. In the Netherlands, we have 17 million inhabitants. And New Year's Eve, during New Year's Eve, we normally have 8 hours that fireworks are allowed. Normally during the year, no fireworks are allowed. And the point is that the combination of adrenaline, testosterone, alcohol, and gunpowder causes a lot of injuries. And Holland goes crazy celebrating New Year's Eve. How crazy? That crazy that the ambassador of the United States in the Netherlands warns US citizens that it is totally normal that you are subject of people who throw fireworks to your person, and a lot of people get injured. This, of course, would be not allowed in the United States, nor is it in Spain. I will explain the injuries by 7 traumas. There are 7 traumas to the eye, which are the following 7: the pneumatic trauma, the blast injury, the thermal trauma by heat, the chemical trauma, the blunt trauma, the sharp trauma, the tattoo of the skin, and also the psychological trauma. The pneumatic trauma is the blast injury. A shock wave goes through the body. And for instance, if a shock wave goes through the lungs, you get these hemorrhages because the very small capillary blood vessels will rupture, and the same will happen also in your retina. Sorry, I have to go one back. Yeah, the mechanism of the blast injury is, first of all, you have this pneumatic primary blast, so the blast wave which goes through your body. The secondary blast is the fragments of the firework, or for instance, if it's put in a glass bottle, then glass fragments will fly around and can hit you. The tertiary blast injury is that people fall over, and the quaternary blast can give you burns. The next trauma is the thermal trauma, because firework, it contains the word fire, and heat is released because you have an exothermal chemical reaction, and so you can get burns to the skin. You can also see in this photograph that this patient, the eyelashes and the eyebrows are burned, as are his skin and his corneal epithelium. The next trauma is the chemical trauma, and the chemical trauma can be very, very tricky. For instance, in this case, you see almost a white normal conjunctiva, but if you look very closely, you see that these very small blood vessels are coagulated. That means that there is no vivid, viable conjunctiva left, and these eyes will suffer and will become blind if you cannot stop this process. And here you see the same patient 1 year later. There is a severe scarring of his right eye. The eye is blind. He had a fornix reconstruction in order to fit a shield prosthesis. And this young 17-year-old boy would like to go to the police academy, but he was not allowed to go into this into the police academy because he had one blind eye, and in order to be a policeman in the Netherlands, you need two normal, good seeing eyes. And at an early stage, the assessment of the chemical injury is difficult, as you see here in this eye. And 1 year later, the same eye looks at as this. This is a blind eye with scar tissue. Even after several surgeries, this eye was not rescuable, simply because of the chemical injury. And the chemical injury can be either acid, if the firework and the gunpowder has not exploded yet, but after the chemical reaction of the gunpowder, you will have an alkali injury, and both are detrimental for the surface and also the deeper layers of the eye. And the chemical injury can be graded by the Roper-Hall classification, which is an older classification, and you can see in grade 1, 2, 3, and 4 increasing that the prognosis in the class or a grade 4 chemical injury is very poor. Another more recent classification of chemical injury is by Dua, published in 2001, and he looked specifically if there is epithelial and ischemia of how many clock hours, and depending on how many clock hours you have ischemia, so coagulated microvasculature of the limbus and the stem cells, the prognosis gets very poor. And for instance, here you see a young girl who was hit by a small firework of her nephew, and she suffered a grade 4 eyelid and eye chemical injury, and her eye never became normal, and it virtually was a blind eye and a traumatized child because it's also disfiguring. The fourth trauma is the blunt trauma, and you have to realize that you have a projectile which is not sharp. It will squash your eye, and what you see then is that the eye is almost like a pancake, and then will get larger, and you will see that you have corneal and lens displacement posteriorly, and once the eye gets to its normal size back, you see then that the lens is displaced. You have angle tears, which can cause hyphema, and also that the lens will become more and more opaque, so you can get traumatic cataract of this stem trauma. And the mechanism of this injury is, of course, because the eye is not compressible. It's mostly water. The cornea and sclera has also limited elasticity, and so once you put too high pressure on the eye, then you get these anatomical dislocations, which are attached to the wall. It depends, of course, on how strong the impact is, and also how heavy the material is which hits the eye. And for instance, in the cornea, after firework injury and a blunt trauma, you will get abrasion and maybe a foreign body which needs to be removed, of course. You can have a decimate injury and endothelial trauma, as you can see in the picture on the lower left side. And that can have long-lasting cornea opacification as a result. The iris will suffer, for instance, a traumatic mydriasis, so the pupil will not work anymore, or it will be there can occur a tear in the sphincter of the pupil. Of course, you can also have iris dialysis, and lastly, hyphema, because the blood vessels which are on the base of the iris, they rupture and then cause bleeding in the anterior chamber. The angle with a blunt trauma can get an angle recession, or sometimes even a cyclodialysis cleft, which need to be closed because it will get hypertonic, and on the long run, and an angle recession can cause glaucoma. So never forget to follow up these patients, because they can develop a glaucoma. Here you see a case that there is iris lesion, but also you see in the depth there that there is a mature cataract and the lens is dislocated. So you need to take that lens out and then do a vitrectomy and see how the aphakia then can then be corrected if the retina is still intact. And talking about the retina, blunt trauma can cause retinal dialysis, and in the long run, a scar, which we call a retinal scleropathia scar. And this is typical for blunt trauma, also for gunshot wounds and firework injuries. A lot of eyes become blind in the long run because they develop this kind of scleropathia scar. There can also be a choroidal rupture, which also can be detrimental for the central vision. Then we go to the fifth traumatic factor in firework injury, and that's a sharp trauma. And this can occur for the upper eye you see on the right side. This was caused because a rocket was put in a glass Coca-Cola bottle. The bottle exploded and the glass ruptured the cornea, the iris, and also the lens. But in the lower slide, you see also a sharp injury, and this was caused because firework hit the patient glasses. So normally we would think that when a patient is wearing his or her glasses, especially if they are non-mineral glass, we think the eye is protected. But if it shatters, then it can be very severe. So in order to prevent that, you have to wear not your own glasses, but safety glasses. And sometimes you can, of course, have a combination of all these injuries, which is depicted like a cartoon on the right side. What also happens that if patients get hit in the face or on their hands or other parts of the body, then gunpowder and also the heavy metals which are included in fireworks will give a skin tattoo, because it with great force these foreign bodies will be implanted under the skin, and you will get a tattoo. And here you see a boy who had 3rd-degree thermal injuries, but also skin tattoos. And you have to really remove and scrape them off within 24 hours under general anesthesia, in order to prevent that he will have a skin tattoo for the rest of his life. And then, of course, you have the psychological trauma. You have to realize that half of the firework injuries are bystanders, and sometimes they are very young, and even at old age they can suffer a post-traumatic stress syndrome, a psychological trauma. And this is what we call the shock after the injury. And this boy would like to become a medical doctor. And he certainly went to a university, became a medical doctor, but he was not allowed to do surgery, because you need 2 eyes to do surgery, especially in microsurgery. Another example of a chemical injury, this little girl was actually a disaster, because she went to a general practitioner and to emergency department of a hospital, and because she was 3 years old, was hit in the eye, but it was not possible to do a real good examination on her, and the emergency staff, they put some antibiotic ointment in it and said, well, come back tomorrow, maybe tomorrow you can examine her better. The problem was that she was exposed only almost 2 days with gunpowder in her eye, and she suffered a severe chemical trauma. So in case you have a child with firework injury, always do an examination and cleaning under general anesthesia as soon as possible. And this is her eye a couple of years later. She had a caustic trauma, 6 surgeries, and of course she was 3 years old, had difficult amblyopia treatment, and in the long run she only had light perception in this left eye. She had severe eye damage, and she was a traumatized child. So one thing you have to learn from this presentation: all gunpowder has to come out. This is the most important thing you have to remember of this lecture. You can forget everything except this. All gunpowder has to come out. And here you see once again a severe chemical injury. On the emergency department, we already, under topical anesthesia, cleaned his right eye out as good as possible. But when we put him under general anesthesia, you could see that in his upper fornix there was still gunpowder. If you leave that there, then this chemical reaction and calcification of delicate eye tissues will continue. So put them asleep and clean as good as possible. All gunpowder needs to be removed. And here you see a picture of double evertation, which means you evert the upper eyelid and then go into the upper fornix with a forceps, and then pull that down and then clean everything out of these eyes, because it can save some vision. Sometimes there is more at hand than only a blind eye. For instance, in blast injuries, you can have a ruptured bulbus, chemical injury, a thermal injury, but you also have to rule out skull, brain, orbital, and sinus pathology. In the CT scan, you see on your right side, you see that there is also a damage to the orbital wall, and even the roof of the orbit with some air in the orbit. This is what also neurosurgeons need to examine. And for instance, here you see a victim of the Brussels airport bomb attack a couple of years ago. And this was, of course, a terrorist attack, which you in Spain, of course, also have suffered. And the injuries are exactly the same. You see the chemical injury, you see the burn, that the eyelashes are burned, and you see even a foreign body in the right orbit, just under the superior rectus muscle. Luckily, the eye was not perforated. Here you see a combination of all the traumas. This was a 50-year-old man who got his right eye removed, and you see the blast injury, you see the burn injury, so the thermal injury. He had a chemical injury, blunt trauma, also a sharp trauma. His skin was tattooed, and he went into a deep depression after he lost his right eye a couple of days after New Year's Eve, which was also his 50th birthday. And here you see some of the late complications of chemical injury. So chemical injury can be a very silent killer of eyes. Now we go back to Happy New Year in the Netherlands. And you see once again some of these victims with here a sclopetaria scar, a chemical injury in a small child. A total skin tattooing with one blind eye, another skin tattoo, and 3rd degrees injury. All seven injuries in one patient. And here you see a ruptured bulbus, a thermal injury, and a sharp injury. This is a sharp injury by exploding a Coca-Cola bottle. Here also an eye which need to be removed. This is a sharp injury because the patient's own glasses were shattered. The total hyphema, also less than 5% visual acuity. But sometimes not only eye injuries. Here you see a hand or what is left of a hand after firework exploded in the hand of a young boy, and this is how it looked after plastic surgery. He has a thumb and a pinky finger left on his injured eye. We started to collect the data of firework injuries because it was very impressive what happened in our country. We did a prospective observational study and collected numbers and types of injury and the population at risk, and also what kind of firework caused most eye injuries. And if you look at the Netherlands, in the Netherlands, firework is not allowed during the year. It's only allowed during New Year's Eve. And in 13 years, we collected 2,578 casualties, patients, and half of them were bystanders. This is a very important political issue. So not injured by your own stupidity, but causing damage in somebody else. In total, almost 3,200 eyes were damaged. 1/3 of these eyes had permanent eye damage, and 207 blind eyes were collected in 13 years of firework eye injuries. And we calculated that for every hour that consumer fireworks are allowed in the Netherlands, that will cost you 2 blind eyes. And who are the victims? Here you see the self-inflicted are about half of the injuries, but the other half are bystanders, and that's very pitiful that you become the collateral damage of the pleasure of somebody who is igniting fireworks and it goes wrong. So 50% are bystanders, and this is what we see in a lot of studies all over the world. And the age of the victims are at average on average are in their early 20s, and most of them, 90% of them, are male. So most casualties and victims are young, some even as young as 3 years. What type of fireworks are then the most dangerous? The most dangerous are the crackers. Then you see the display fireworks in orange columns. Then, of course, you see the bottle rockets. The rockets can go anywhere and can cause, even at 50 meters distance, can cause blind eyes. Sometimes you have these in combinations, and the blue part in the columns are the unknown, because 50% are bystanders, and some of them simply don't know who or what hit them. And most of it is legal fireworks. So legal fireworks is what you buy in the shop and are allowed to ignite during New Year's Eve. And to put that in perspective, in 2008, there was a study in which determined how many eye injuries were occurring during Operation Iraqi and during freedom in Afghanistan in the American Army. And in the 3.5 years of combat war, the American Army suffered 523 eye injuries. Well, in the Netherlands, we only need 2 Sylvester, two New Year's Eve to have more than the American Army had in 3.5 years of combat and war. Now, in the beginning, 13 years ago, it was still possible to to ignite fireworks 16 hours on December 31st. So it started at 10 o'clock in the morning and then until 2 o'clock at night. That was halved in 2016, and you saw a little reduction of the eye injuries. But last Sylvester, because of Corona and COVID-19, public firework, public gatherings, and also consumer fireworks was not allowed. And we saw a 75% reduction of eye injuries. So what we are praying for the last 13 years is that there should be a ban on consumer fireworks in the Netherlands, because it causes too much eye injuries. Also in Germany, we have the same trend. 36% are minors, 60% is younger than 25 years, 60% were bystanders, and 75% are male. So it's comparable in Germany. We have a fierce campaign in our country to make the public aware of the danger of fireworks, and also the public opinion is changing now. So, and we lobby for we lobby for a ban on consumer fireworks because that's the only solution which will help here. The protective measurements are restrictions, only legal certified devices, and also time slot restrictions. So if you do it, for instance, only 15 minutes before and after midnight, that would also especially save a lot of children's eyes. And of course, protective glasses is also something which we advocate, and it will prevent about 80% of eye injuries. The Dutch National Security Board said New Year's Eve is the most unsafe evening of the year. And I would not advise somebody from Spain to spend New Year's Eve here in the Netherlands because I cannot guarantee your safety. The government has already banned the crackers and rockets, and firework sellers are now demanded to also provide free protective glasses, which is of course okay for the people who uses firework, but not for the bystanders. And so the best protection is total ban on consumer fireworks, and we rather would like to ignite a public firework, as you see here on the Rotterdam Erasmus Bridge. This is professional fireworks, and hundreds of thousands of people can enjoy it. So this is actually what is concluding my presentation. I hope you learned something. The most important thing is if you see a firework injury, please remove all the foreign body, especially the gunpowder. Thank you very much. Hasta la vista. I hope you have a good meeting. Thank you.